This is TTT Live. I'm DK Roster. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dial Singh, the Chief Medical Officer, Dr. Roshan Parasaram, and Keisha Privat Gomez, Infection Nurse at Cora Hospital. Let us now hear from the Minister of Health, the Honorable Terence Dial Singh, who will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to the Chief Medical Officer, and good morning to Nurse Gomez. Also, a very good morning to ladies and gentlemen of the media and everyone who is listening or looking on, whether in Trinidad and Tobago or elsewhere around the world. Today is June the 1st, I believe, of 2020, and as announced by the Honorable Prime Minister on Saturday the 30th, we have an early start to phase 3 of the reopening of the economy. This is consistent with our carefully developed plans to reopen the economy and to collapse some of the phases, as we said from the very beginning, once the numbers are good. On Saturday, the numbers for Trinidad and Tobago stood at 116. And those numbers were fairly static for about a month, I believe. After the Honorable Prime Minister made his announcement, we did get word at around 5:30 on Saturday afternoon that we did have one more case, which luckily was an imported case. So because it was an imported case and not picked up from the community, that case was a family of 3 who would have come in by air ambulance from Houston on Thursday evening, I believe. As per protocol, they were taken directly to a quarantine facility, that is the home of football, and as per protocol, the family of 3 would have been swabbed sometime late Thursday or Friday morning, and we got the results by late Saturday afternoon. The family was never allowed to go home as per protocol, and this speaks to how robust we are in Trinidad and Tobago, because then we don't have to do any contact tracing, and there is no possibility that other family members, other members of the household, friends, family, public transportation or anything would have been an issue. So there is no need for contact tracing. The reason why we are concerned about another imported case is this. Whenever we speak at these press conferences, I think we always give the global figure. And we give the global figure to remind citizens of Trinidad and Tobago that Trinidad and Tobago is still surrounded by coronavirus. I know that many citizens feel that the threat has passed, but with this latest imported case, it should reinforce in the minds of citizens that the threat has not really passed. Because as we accept more and more people onto our territory in a very measured way, I think what happened on Saturday afternoon speaks volumes to the careful way we have been managing having our citizens come back into the country. There was a call by one ill-informed person to bring in 1,000 people because we have 1,000 beds in the parallel healthcare system. I think we have exploded that theory. And where are we in the world today? 6,302,150 cases. That is the population of CARICOM. It's like having the whole CARICOM, every man, woman, child, prime minister, nurse, doctor in the CARICOM region infected. That's a number. The number of deaths, 374,554. In the Trinidad and Tobago setting, that is about 5 times the population of Tobago. It is probably the entire southern part of the country's population, or the entire east-west corridor have died. That is why we always emphasize at these press conferences, the virus is around us. Yes, Trinidad and Tobago has done an excellent job, but the threat is out there, and the threat is still real. And as we bring in more and more people from different sources, whether it's from University of the West Indies, the cruise ship employees, the people in Venezuela, the people from Guyana, as we bring in these people in a very measured way, it is this measured reintroduction of people into Trinidad and Tobago that will save us. Because that one case which you got on Saturday should remind us that you simply can't flip a switch, whether it's for the economy or whether it's for re-entry into Trinidad and Tobago. It has to be a gradual, well thought out, measured process. Today, June the 1st, is fortunately, and I'm happy for it, the opening of all retail outlets. That's a good thing because it means people can go back to their jobs, business can start back, business activity can start back. That is a good thing, and I'm happy for it. Very, very happy for it. But from the health perspective, and this is why we have Nurse Gomez this morning, with more activity, because I noticed the amount of traffic on the road coming in this morning, with more traffic and more movement of people, the risk of transmission from person to person increases. So what can we do as a society to protect the gains that we have made since February the 7th, when we did our first test, to now? What can we do as a country? How can the responsibility be shared amongst all of us? 2 simple things, and Nurse Gomez will go into it in detail. No mask, no service. I am appealing to retail outlet owners, managers, mall owners. The same way a bar can have a sign up, no beer back, no sleeveless, no slippers, you have the authority to tell people no mask, no service. This is your contribution to what's keeping us safe. Hand sanitizers, very inexpensive. Anyone coming into your store or place of business to transact business, and we want economic activity to start back. We encourage it. We are glad that we could bring that phase forward. We are glad. But with that happiness comes an increased sense of responsibility on all our parts for the public hygiene methods. So I am urging everyone, as we open up the economy this morning to a very large degree, these are no longer baby steps. These are now adult steps. These are leaps. And with that leap comes a leap of faith. And the leap of faith is that we can all behave responsibly. Before I hand over to Minister Cox, as we go back to some state of normalcy in the public health sector, I would have announced weeks ago that we have restarted elective surgeries. That is going well, and you will be contacted to come in to get your elective surgeries done. I can now announce that the Princess Elizabeth Center, which we had earmarked and used for a very small number of patients, our last patient there was on May the 13th. Princess Elizabeth has now reopened. They have resumed their walk-in pediatric orthopedic clinics, and they have restarted their surgical procedures. So that's some good news for these elective type surgeries, and I'm happy for the children of Trinidad and Tobago that they can now go back to Princess Elizabeth Center and get the services that they so richly deserve. So, Minister Cox, that's my report this morning, and I thank you.
Thank you very much, Minister. The Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Hi, good morning, honorable ministers,
Good
members
morning.
of the media, members of the viewing and listening public. So today's update for 1st of June 2020, the number of samples submitted to CAFA as well as the UE site, 3,155. Number of repeated samples, 440. Number of unique patient tests completed thus far, 2,715. The number of community samples totaling 1,324, of which 106 came from Tobago, all of which are negative, therefore leaving us with 117 positive cases in Trinidad and Tobago. Total number of discharges thus far are 108. Number of deaths, 7 in Trinidad, 1 in Tobago over the period. The one patient in the system remains at home or football with their relatives. In terms of the parallel system, we have a total of 77 people housed, 59 at the Debe Penal Campus, 5 at the Cascadia Hotel, and at the Home of Football, we have 3 individuals. The persons at Debe, I am told, 7 of which are due for discharge on Saturday, and the remaining 50 odd are due for discharge on Monday. Minister Cox has my clinical update for today.
Thank you very much, Dr. Parasram. Keisha Privat Gomez, infection control nurse at Cora Hospital, will speak on the guidelines for wearing a mask.
Good morning, everyone. I am one of the infection control nurses attached to North Central Regional Health Authority. We have adopted guidelines on the safe and proper use of face masks so that our staff, our visitors, and the wider community can be safe. Today, I would like to share some of those tips with you. 1. Persons need to know that the proper use of a face mask traps the droplets when a person coughs or sneezes from being dispensed into the air. In addition, the droplets, once you have on your face mask, it cannot fall on the surface, so it protects in that way as well. When you have on a face mask, it avoids persons from touching their face, from touching their nose, from touching their mouth, so it also offers protection that way. Some key things to remember. When you are wearing a face mask, it is important to note that you should not allow the mask to dangle on your earlobe. You should not wear the mask under your chin. You should never touch the front of the mask while the mask is on your face. All these instances will allow opportunities for cross-contamination. Now, if your mask is to be reused, it is important to identify the front of the mask. Whether it is a surgical mask that is used in the hospital, there is a blue side and a white side. The front of the mask is always colored. If it's one of those face masks that you use at home, the persons in the community, the front of the mask, you must always be able to identify same, so that when you have to reuse the mask, you will always know where the front of the mask is. When you have to put on your mask, you take it out from a safe, clean area. You can store it in a brown bag, or you can store it in a Ziploc bag. Ensure that the mask is not put inside of your pocket or your handbag, or that it is not crumpled up, so that may impede the integrity of the mask. Make sure that your hands are clean prior to putting on the mask. You can either wash your hands or perform hand hygiene prior to putting on the mask. This is important. Once your hands are dried, you get your mask, you hold it at the loops, you put it around your ear, you pull it down to your chin, covering your nose and your chin, you fit it snugly to your face, and you keep your mask on once social distancing cannot be maintained. The only time you remove your mask is when social distancing can be maintained. Now, in removing your mask, you at no point in time touch the front of the mask. You take it off from the clean areas. You fold the mask, the front of the mask, you fold so that the front of the mask will touch each other and the inside now becomes the outside. And you safely put the mask into a paper bag so that it can be reused, and you store it lengthways. It is important to know that after removing the mask, you perform hand hygiene a second time, as you may have touched the front of the mask while removing same. Persons need to know that wearing a mask alone is not going to protect you. So you need to maintain social distancing. You need to perform proper hand hygiene. You need to stay at home when it is necessary and only go out either to work or when you have to go out to get stuff. All these things in conjunction will protect you and your family from becoming infected with COVID-19.
Thank you very much. Thank you very much. Members of the media,
I learned a lot.
the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. Priya Bihari.
Hi, good morning, everyone.
morning.
I wanted to find out, since we are in election year and candidates are working now, is there any guidelines for them? And Mr. Diasing, have you started working to any constituency? Because I don't think in regulations there are anything for the candidates. You can just specify that,
Sure.
please. And the other question is, the patient that we have now at the home of football, why was the person not at the Cuba facility, hospital, as opposed to the house of home of football?
That will be easily explained. So I will take the first part of the question. The regulations are pellucidly clear, not more than 5 people. So anybody who wants to be outside for any purpose, you are not supposed to surround yourself with more than 4 other people. You and 4, that makes 5. I did see a photograph of a candidate walking in Bamboo last weekend with about 15 people. That is clearly not advisable. And whether I have started walking, this is a Ministry of Health platform. I will not discuss political activities, whether it's mine or anybody else's, especially mine. I will not take advantage of that opportunity to discuss my political activities on a Ministry of Health platform. But the regulations are clear, no more than 5 people. Thank you.
Thank you.
Okay, so in terms of the patient at home of football, with this patient and with other patients, I would have consulted with the team at Cora, which is led by Dr. Trotman, as well as the County Medical Officer of Health. I would have discussed the results with the Caribbean Public Health Agency to determine what is the best fit for the person. So in viewing the results, I was told by the Caribbean Public Health Agency that it seems like a weakly positive result, meaning in this particular instance, it seems like the period of infection would have been passed in terms of significant infection, and they would now be in an almost convalescent stage. As you would remember, home of football was used for convalescent patients in the past as a decanting facility. So instead, the patient actually has no symptoms since coming to Trinidad on Thursday, or very mild symptoms, which were not given on the examination. So we continue to feel that the best place right now is in a step-down facility without having to step up to a hospital. Having said that, of course, if symptoms develop or symptoms become apparent or get worse, the person will be placed into one of the hospitals as need be. But for now, we think based on the results, based on the symptomatology and consultation with the Caribbean Public Health Agency, that the patient is best suited for that facility.
Thank you very much. 98.1.
A very good Monday morning to the panel. Stephen Cummings, 98.1 FM. My 2 questions quickly, one for Nurse Gomez and the other for Minister Dialsing. Ms. Gomez, I'm going to start with you first. We are going to be beating this drum for a very long time, and that's the issue of mask wearing. We have another social issue in the country with the inability of our differently abled or deaf community, as they depend largely on lip reading and facial expression for effective communication. People who are deaf or have hearing loss are now given that additional challenge. I'm not sure if you can speak to the issue in terms of guidelines as to how we can go about treating with that section of our population.
Okay.
And Minister Yalsing,
sure.
In the context of the expected inflow of citizens in the coming weeks and months, can you speak more on the building out of additional patient housing and care capacity, reference which was made on the last press conference?
Sure.
And how early would you be able to have, let's say, an updated list of these facilities?
Sure. So I will start off to contextualize part one of your question, because we did speak to this issue last week, Wednesday. Because there are certain sectors of the society that can't wear masks, and let me go over them again. Those suffering from asthma, other breathing difficulties, COPD, and now we are including the deaf. Because they can't wear masks all the time, we have to make allowances. And the allowances will fall into the following categories. One, they should be excused from wearing masks. And two, it becomes more critical that the rest of us who can wear a mask actually wear a mask to protect them. It's like the whole concept of herd immunity, which we spoke about last week, Wednesday. There are some people who can't be vaccinated for medical reasons. Maybe 3% of the population. And that is why when we talk about MMR and the CMO will come in, you need to have 97% of the people immunized. Herd immunity, not only to protect 97%, but to protect that 3% who for a variety of reasons can't be immunized. They may be allergic or some other reason. So all these special categories, the deaf, the asthmatics, who can't wear a mask, our way of loving them and appreciating them and saving their lives is for us who can wear a mask to wear a mask. Nose Gomez will pick it up. On the building of other facilities, yes, that conversation started on Saturday, but we don't have details as yet. It is only 48 hours. As soon as we have more details, we'll come back to you. But we are committed to building out or acquiring more facilities. Nose Gomez.
Listen, they are saying, I just want to endorse what you've already said. Persons who are not able to wear the mask, this is where the wider community has to protect them. And we are protecting them by wearing the mask so that they who cannot wear it will be safe.
And just to add, I think he was speaking more of the ability for persons to be able to read your lips when you differently abled. I know some countries have advocated for the use of transparent masks. It is something that we can look into. Of course, persons that would be in close contact relatives and the like with those individuals, it might be an option to use some sort of transparency on the area close to your mouth so that the reading of lips can be done. So it has been done in other parts of the world, and it may be a possibility.
Thank you. TV6.
Good morning, everyone.
Good morning.
Good morning, everyone.
Good morning.
Elizabeth Williams, TV6 News.
Morning, Elizabeth.
I know that the Prime Minister announced on Saturday with respect to the numbers for funerals to increase to 10. Some persons are asking if this will be the same for weddings, and some are also wondering how soon will gyms reopen.
Okay.
And my second question is, I know that Minister Cox would relay the information. Some employees of the forestry relations to the forestry workers under the rehabilitation program, they were complaining about outstanding monies not being paid for a significant amount of time. I don't know if you can look into this and send it to the relevant agency.
Okay, I will go first. Elizabeth, you know that this press conference is particularly for COVID-related issues, but I will speak with the Minister of Agriculture and try to get back to you. Okay?
Okay, so thank you, Elizabeth, for the question. It gives me an opportunity to repeat and clarify. So the increase of from 5 to 10 applies only to funerals. It was done in an effort, let's use the word humanitarian grounds, when a life, to celebrate how a person has lived. 5 was presenting a bit of a challenge to families, and the Prime Minister in his wisdom thought that we should increase that to 10 only for funerals. It does not apply to weddings, birthday parties, christenings, any other activity. It applies only to weddings.
To funerals.
To funerals, sorry, to funerals. It applies only to funerals. Monday morning blues. Let me repeat.
Yes, weddings on your mind, Minister?
Weddings on my mind. I'm married to 37 years now, we're good.
Oh,
it applies only to funerals. On the issue of gyms and other high contact places, the problem with gyms is that it's a high contact place moving from machine to machine. It is also a place where people exhale and inhale deeply. And when you exhale vigorously due to physical exercise, the droplets that Nurse Gomez spoke about can travel further and further. So the risk for infection in a gym is very, very high, extremely high. So we are not looking at gyms as yet. They will come in a future phase. So right now, it applies to all retail. It does not apply to gyms. It does not apply to hairdressers, manicurists, massage parlors, but it does apply to physiotherapy, which is a medical procedure. So I hope that clarifies the issue. And let's wait and see what kind of numbers we get to see how fast we could advance other phases. Thank you very much, Elizabeth.
CNC3.
Hi, good morning.
Good morning.
Good morning, Minister. Good morning, CMO.
Morning.
Christopher from Guardian Media, CNC3. I just wanted a bit more clarity with regard to the case that tested positive with regard to the exemption. I recall that the CMO spoke about it being a medical exemption, I believe. We just want to get some more clarity. When was the application made for them to come in, and when was it approved? And with regard to just going back to Tobago for a bit, on Saturday, of course, there was an announcement that there would be expansion of the services along the air bridge. What regulations will be put in place with regard to travel between the islands, given that this exemption, this expansion has been announced?
Mm-hmm. So I didn't say there was a medical exemption. I said there was a normal exemption, which is the purview of the Ministry of National Security. So what I indicated is that an exemption was given, and following that, we determined that the person should be placed in state quarantine. So it wasn't a medical exemption. There's no such thing as a medical exemption. We determine what sort of, depends on the illness of the person, when they return, which sort of facility they need to go, because there are some persons that once they return, they need to go to a hospital directly, and those arrangements will be put in place by the Ministry of Health once the exemption is granted by the Ministry of National Security. In terms of your second question, as it relates to the air bridge, what Caribbean Airlines has agreed to put in place is 50%, if I remember right, of their occupancy as they travel from the air bridge. There would be wearing masks, and there would be sanitizing of the aircraft both before and after the flight is completed. So those are the things they're putting in place in the first instance.
Express. Express? Is Express on?
I'm sorry, good morning. Am I being heard?
Yes, we are hearing you.
Yes, morning, CMO ministers.
Morning, Kim.
Okay, so Minister Dayal Singh, the back to work back to work from last week. So just anything interesting that may have come to you from that, or people, or employers saying anything interesting about how their employees are handling the new normal, or employees saying anything, any overall observations as to how we are handling the new normal? I know there was a problem with the wearing of masks. We did hear one of your public experts. There have been some issues, I would say, like, for instance, as a reporter coming to me, I have persons who own supermarkets, taxi drivers, saying that people are simply refusing to wear the masks, and they want to know how to deal with that. Yes, they can refuse service, but I think when it comes down to it, it's a bit awkward for them. So people keep asking, how can we really get people to wear our masks? Sometimes they don't even have it on them. So maybe an overall on that. And if you could, Minister Dalsing, also provide an update on some other persons, some other nationals who are outstanding. We have persons in Venezuela. We have some nationals, I think, some students as well, still around the region. If there's any update available on them, when they may be coming, if you have been in touch.
Okay.
Thanks.
Thank you. That's it for me? Right.
Yes, Minister,
so let's
thank
go.
you.
So yesterday, Sunday morning, I had a meeting in Port of Spain at 11:30. So I left home early, and I passed through the Quaysay, which is in my constituency, and I passed through Independence Square. And I stopped on Independence Square, actually opposite Express House. And I spoke to lots of people on Brian Lara Promenade. I spoke to about 20 people. Of those 20 people, if 2 people had on masks, that was a lot. And they were around the tables, close proximity. And when I approached them, I said, I'm coming to find out from you guys, what are your thoughts on wearing masks? And why you're not wearing it, and you're talking to each other 3 feet apart around the tables on Brian Lara Promenade, right opposite Express House there. Everybody went into their pocket and pulled out a mask. Everybody. So it's a public education process, but the minister can't go out to talk to 1.4 million people. Everybody had a mask, but everybody had a mask in their pockets. Having a mask in your pocket does not protect you. Having a mask in your pocket ensures that you catch the virus and you take it home and infect your family. And literally, and I'm going to be graphic here, doom some people in your homes to death. This mask wearing is not meant to be punitive, it is meant to be protective. It is the way you show love and appreciation for life. And you tell the other person to whom you are speaking, I love you. And I'm not giving you the virus, and the other person should have a mask saying, I love you, I am not getting it from you. On my way to work, I always slow down on the Quaysay, where the taxi drivers who ply the Arangwes main route in the constituency of St. Joseph again. And this morning I slowed down and I looked. Not one taxi driver, because they stand up and wait for passengers, not one taxi driver on that taxi stand had a mask on. And they are under threat because they don't know who they are transporting, where they came from. They are making these trips up and down. So the taxi drivers, maxi taxi drivers, you need to wear a mask to protect yourself. Because an infected passenger coming to you, and then you take the virus home to your family. So wearing a mask is really something that all persons, once you are out in public, should wear. And there are certain categories of persons who are at more risk. So public transport is one. So PTSC is a policy that's state-owned. But the maxi taxi associations, maybe we need to meet with them and do a little seminar with them. But we could use this medium, to talk to maxi taxi drivers, to be as responsible as all the doubles vendors I see. The doubles vendors have led this from the beginning, and I want to congratulate them. Every doubles vendor I have seen is wearing a mask. And they are actually insisting that their customers wear a mask. So let public transport people come on board. The second part of your question had to deal with, just remind me, Kim, briefly, and I will try to be brief.
Yes, I'm here, sorry. It was any update is available on our students.
Yes.
in the
Okay,
region, and
yes.
there were some persons in Venezuela as
Yeah.
well also trying to
So
get home.
for this week, we have coming in 29 persons from one of the cruise ships. Hopefully, they will go to Tacarigua. We have the party from Venezuela that we have been expecting on and off for about a week and a half or 2 weeks now, 30 from Caracas. We are keeping Brooklyn and Sangre Grande ready for them. And we have 10 persons expected from Guyana. They will be going to the Pinal DB campus. So in all, we have 69 people we are expecting this week. And when you add that to the 67 we have in care now, that will take us up to about 136. The others, we can't bring all back at one time. So we are working with the Minister of National Security to have a staggered approach to bringing back people as quickly as possible. Okay, thank you.
Thank you. Yolan Thomas.
Hi, good morning, Yolan Thomas from Caribbean Lifestyle Communication.
Morning, Yolan.
I'm just trying to get an update. On Saturday, the Prime Minister stated that the CMO, as well as the Minister and the Minister of National Security, should reach out to persons from cinemas, bars. I just wanted to find out if you all have an update on that.
Yeah, so both CMO and I will do that. Cinemas, bars, casinos, you forgot that one. Yes, WHO has some protocols, but we are going to localize it. We are reaching out to these people. We are also reaching out, I myself, to all the, well, not all, most of the religious associations to get their protocols, to consult with them, because we will want to open up places of religion eventually. So cinemas, bars, casinos, places of religion, hairdressers, and so on, we are looking at all the protocols to have a safe reopening of all of these, and we be doing that within the course of this week. Thank you.
So I have already received the submissions from the Bar Association as well as from the casinos and the cinemas, that the latter two was received by the Chamber of Commerce. So we're looking at all those different protocols and policies that have been submitted, and we will have, it is an iterative process with us and those different committees. So we will be working hand in hand with them to ensure that when we go to that phase of reopening, that they are well prepared to do so.
Okay, thank you. Before I take another question, there's one online and concerns wearing of masks. Please clarify why students writing exams, the second Cape, do not have to wear masks. And
okay, so I had a discussion together with my PS and the PS from Education about a week and a half ago regarding the wearing of masks during examinations. We agreed collectively that the best approach will be to create large social distancing between those individuals. They will use maybe just a small amount of people in one particular space at any given point of time. There will be no congregation before and after exams. We'll sanitize all the surfaces. Of course, if someone is ill, we are looking to do temperature monitoring as well. If they are ill, they won't be allowed to come into the space. With regards to even the parents, there won't be the gathering outside. We will ask that they drop their children off and return for them at the end of the examinations. So those discussions are ongoing with Ministry of Education, but the wearing of masks will be negated by the use of social distance in that particular instance.
thank you. Newsday?
Yeah, good day. Can you hear me?
Yes, we are hearing you.
Okay, right, great, great to see everybody. And Minister Delsing somewhat anticipated my question. I was going to ask, basically, for today's reopening of the retail sector, how are the authorities really going to oversee it and monitor it and engage the success? Not just on the economic terms, but in terms of whether it's producing an opening for this virus to spread. I appreciate very much the minister's anecdotal approach, very hands-on, talking to these taxi drivers and so forth. But is there any systematic way of doing it at all?
Yeah, so the
second question I would actually ask is, in terms of the Prime Minister inviting everybody to Tobago, very lovely, recently, well, can we ask what the situation with the beaches will be in Tobago? Is there any consideration to make an exemption for Tobago beaches if this is a mainstay of the Tobago economy? Thank you.
Okay, so I will take two parts of the question and CMO will deal. On the issue of retail, food, and so on, we have a system of public health inspectors. We have a system of county medical officers of health that monitor these things, and the CMO will go into detail. On the issue of beaches, no decision has been made to reopen beaches, rivers, waterways to Lime, whether it's in Trinidad or Tobago. That poses a congregation risk. For pleasure, we don't want to go down that road as yet. Any minor congregation that we are looking at right now has to be for economic activity. Let's get people back out to work and so on. Congregation for pleasure, whether it's bars, casinos, beaches, rivers. Let's deal with that at a later phase. Chief Medical Officer.
In terms of the monitoring and evaluation plans, they were part of the initial guidelines that were submitted. What we envisioned is, of course, a combination of policing, meaning the public health inspectorate would be going from one institution to the next to ensure that the guidelines are being adhered to, and of course assist in how you can actually do your individual protocols as it relates to the guidelines. So that is being done through Ministry of Health, Ministry of Local Government, and in combination with the Trinidad and Tobago Police Service. So that has been ongoing since the beginning of, I would say, phase one, when we began to open different parts of the economy. And that will continue throughout the phases as we go forward.
91.9.
Hi, good morning. Verne, Extavour, 91.9 FM.
Good morning, Verne.
I just wanted to ask a quick question about other surgeries, elective surgeries, and the development in that particular sphere, because there is a concern that many persons may not have been accessing surgeries in a timely manner and may have been resulting in them experiencing some increase in symptoms or their situation becoming worse simply because the surgeries were not as accessible or being accessed. And I've also noticed a particular text drive coming through about blood and people looking for blood donations. Well, not people, the Ministry of Health in particular, asking for blood donations. Right. Could you give us a status update in terms of the blood situation and those particular surgeries, whether we are running a risk of persons getting increasingly worse in those particular?
So as a general policy, when you have an event come into our healthcare system, whether it's a hurricane and you have 2, 3, 4 days notice for, whether it's a flood that you may have notice for, coronavirus that you may have notice for, as part of your protocols, you start to prepare your healthcare system for what is called a surge. That is an increased number of persons seeking emergency medical care. So if it's a hurricane, it's cuts, bruises, fallen trees, broken arms, whatever. In the case of coronavirus, it was an infectious disease. At the start of this, when we started to build out this system in January, we had no idea what numbers to expect. None. If we did not take the steps that we did, and we got a massive surge and you couldn't cope, that would have been a disaster. As part of your disaster planning, whether it's an advancing hurricane that you have notice of, or part of a global pandemic that you have notice of, one of your strategies is always, across the world, to stop certain non-emergency procedures. For example, elective surgeries. However, about 3 weeks ago, when we got over our first wave, we started back elective surgeries. You also have to remember, and I think the population fails to understand, that sometimes we may take these successes for granted. As Minister of Health, when you are managing this, 2-3 months ago, you were faced with a total shutdown of global supply chains. People couldn't get PPE. It is the same PPE we had to reserve for frontline healthcare workers to treat with COVID. If we did not do that, we would have run out, because it's the same PPE you have to use in a surgical setting. So there are a lot of variables. And as I said in earlier press conference, this is not playing drafts. This is playing three-dimensional chess. The variables come at you hard and fast, and you have to be one step ahead of all these variables. So elective surgeries were started back about 3 weeks ago as we get our healthcare system back to normal, inclusive of what I just announced, that Princess Elizabeth now is going back to normal. So we are trying to preserve the parallel healthcare system for COVID and get the normal healthcare system back to a state of normalcy. So the CMO can probably come in again now on clinical details.
So in terms of the blood donation, which is the second question that you asked, earlier on in the year when we had continuously updated the figures, we noticed a drop as soon as March, I believe, when we actually started to restrict the number of persons coming into the facilities. There was a decrease. And of course, everyone was told to stay at home. So moving into the facilities and the blood donation centers decreased, and so did the number of units that we were receiving. We had 2 drives since. I think there was a University of the West Indies blood donation drive. I believe it was the 18th of April or thereabouts. Southwest Regional Health Authority also had a blood drive. What you got in terms of text is really the ministry's way in terms of public education to get persons to begin thinking about blood donation again. I know there are a number of voluntary blood donors in the country, and we are encouraging you all to come out. The blood is, of course, needed as always. So the blood donation centers are open and willing to accept your donation. So the public education part of it, as it relates to the text, are really to try to get persons to now come into these blood donation centers and donate so that we have enough blood for everyone.
Guardian Media Limited.
Hi, good morning. Kevon Felmine from the Guardian Media. Given that Royal Caribbean has agreed to allow their version of the Siege cruise ship to be used as an offshore quarantine facility, the company is now requesting approval to begin the workers' quarantine period before they arrive in local waters. So, can this work? And or is it a case where... hello?
Kevon, I think start over. We didn't hear you clearly from the beginning.
Okay. Given that Royal Caribbean International has agreed to allow their version of the Siege cruise ship to be used as an offshore quarantine facility, the company is requesting approval to begin their workers' quarantine period before they arrive in local waters. Can this work, or does the quarantine period begin when the nasal swabs are taken? Also, how will that offshore process work regarding how the healthcare professionals and the cruise ship workers operate?
Okay. So in terms of the quarantine process prior to coming into waters, the quarantine process can't really begin before you come into Trinidad and Tobago waters. More so because that is the same vessel, if I remember right, that had 8 positives out of 356 from the Vincentian cohort of that ship. So when the ship comes into Trinidad waters, we have to do a similar assessment that was done in terms of St. Vincent, meaning taking samples from everyone that is on board, determining whether they are positive or negative. Based on that finding, then we will determine what is the best way forward. Of course, if we get a large group of positive people, the ship itself will become almost as an infected vessel. So we have to look at alternate means of quarantining. So it really depends on what we find when we do the sampling, when they come into Trinidad waters, but it can't be prior to coming into Trinidad waters.
Thank you very much. I'm sorry that we would not be able to take any more questions because of time constraints. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. As you are aware, the Prime Minister recently lifted some more of the COVID-19 restrictions, and starting today, all retail businesses reopened but must close by 6 p.m. The entire public service resumed work today. All managers were asked to report for duty, while other members of staff will be allowed to report on a rotation basis. Professional service providers such as architects, surveyors, and engineers can resume work from today also. Maxis and taxis continue operating at 50% passenger capacity. Air Transport to Tobago and all activities of the National Lotteries Control Board resumed today. However, gatherings will remain at 5 persons, but funerals will be allowed to have a maximum of 10. From June the 8th, hairdressers, barbers, spas, and domestic workers will be allowed to resume duties. And from June the 22nd, religious institutions will be opened. These COVID-19 restrictions were relaxed because there is no worrisome change in our numbers, but we must be disciplined and follow the public health guidelines to ensure none is rolled back. Our borders remain closed, except for the managed entry of persons. I wish to remind you to wear a mask at all times. No mask, no service. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.
And that was an update on the COVID-19 pandemic from the Ministry of Health. Just a quick review of some of the key points we heard. The 117th positive case did not derail the start of the third phase of reopening since it was imported and taken directly to a health facility. Now, that also means there was no need for contact tracing since the person in question did not interact with anyone who was not prepared to greet them. Reasons were given for the person being placed in a convalescent home, which has been used as a decanting facility. And this also underlines the need for a measured approach to having nationals repatriated. The Princess Elizabeth Center has now resumed walk-in pediatric clinic and elective surgeries. The CMO itemized some protocols for students undertaking exams, while saying that dialogue continues between the Ministry of Health and Education's representatives. Now, Nurse Keisha Prevat-Gomez, infection control nurse at Cora Hospital, she gave some very practical guidelines for wearing and reusing a mask. So I guess we will be seeing members of the panel walking with their brown bags or Ziploc bags to the next media briefing. The Minister of Health reminds us that wearing your mask is one way to say I love you, while individually shouldering collective responsibility. And of course, we are being reminded we must stay at home to stay safe and save lives. I'm DK Rostar. Stay with us here on TTT, Talk City 91.1 FM, Suite 100.1 FM, and on Facebook at TTT Live Online for the latest COVID-19 news.
The winning numbers in the National Lottery online draws for Monday, 1st June 2020 at 10:30 a.m. Playway, the number 20 Dog, Mega Extreme Ball called. Pick 2, the numbers 28 and 3 in that order. Pick 4, the numbers 1, 1, 4 and 8 in that order.
Vimcut AutoStar provides turnkey vehicle